Hi everyone, this is Dr. Shibhangi Das, Ayurvedacharya DS Research Center. DS Research Center has been working for cancer patients since 1965. Cancer, it is one of the most dreaded conditions of health. Even WHO considers that lack of information regarding this disease is more hazardous and has been insisting on collection of information management of data regarding this disease. DSSS Center aiming the same comes up with different discussion sessions, webinars to address the lack of information regarding this disease. January being the month of cervical health awareness, DSSS Center has come up with the discussion on the same topic. Women in our society are little reluctant discussing their health issues, and when it comes to the menstrual cycle related problem or any problem related to reproductive system, they are more shy. So we have our two eminent doctors, Dr. Divya from Bangalore and Dr. Sirisha from Hyderabad, to address this situation, that is lack of information and lack of discussion. They carry immense information and knowledge in the field. So I would like to invite both of them to join us in the discussion today.
Thank
Thank
you.
you, ma'am.
Okay. As I mentioned previously, that women are a bit reluctant discussing their issues. So we have to understand what exactly is cervix, and as we have the topic that we have to discuss about what abnormal cells that may lead to development of cervical cancer, so that people know, so that women know it is preventable or it is possible to detect it in early stage to save themselves, because information regarding early detection, screening, prevention, risk factors, causes. Whenever a person or woman has that, she can save herself. So, I will start with Dr. Divya. Dr. Divya, please explain us what part of the woman's body is cervix.
Cervix is a part of uterus, that is the one which is next to vagina. Okay. After cervix comes the body of the uterus. So cervix is the place where the sperm passes through, and cervix is the area where the fetus comes out from the uterus. So it is very important to maintain the health of the cervix, because any abnormal changes in the cervix indicates some serious problems. It could be white discharge or any foul smelling discharge or any any abnormal discharges like bleeding along with the white discharge. So all these symptoms usually indicates some serious problems. And most of the time the women who is affected with cervical cancer shows up with symptoms like bleeding, unusual bleeding for vagina between the periods, and bleeding during intercourse, bleeding after intercourse. So all these symptoms are generally indicating, some major abnormalities in the cervix area, which should never be neglected.
So one, I would like to ask you this question, that what are the alarming signs or what are the primary signs that we need to uh, watch out to understand that cervical cancer might be developing in the body?
Yes, as I said you, women with cervical cancer generally shows up with the symptoms like bleeding during or after intercourse. Bleeding could be after menopause, and the regular menstrual period might be longer and heavier than usual. There will be excess vaginal discharge, which could be a watery discharge or a white discharge tinged with blood and with a strong foul smell. There will be unexplained and persistent back pain and pelvic pain, and there will be bleeding between the periods. So these symptoms are specifically for cervical cancer, and apart from this, the common symptoms of cancer like weight loss, weakness, reduced appetite may also be seen in case of cervical cancer.
Okay, thank you. As we come to know that most of the times the primary problems are weight loss, loss of appetite, back pain. So most of the times they get ignored. But as you discussed this, that these can be primary symptoms, so we have to dig in more. So thank you so much for replying this query. Now I'll move to Dr. Sirisha. Dr. Sirisha, thank you for joining. Uh, as we discussed, what are the symptoms? We have to understand what might be the causes for cervical cancer.
Yeah, this cervical cancer actually it is the fourth most commonest cancer in the woman. Okay, and people should understand what are the causes. So based on the symptoms, if we can identify the causes also, then it would be easy to detect also. And foremost, the main cause will be the human papilloma virus. This is a virus which is sexually transmitted virus to the woman, and this constitutes to more than 80% of the cervical cancers. And not only cervical, other cancers like ovarian or anal cancers or renal cancers and oral cancers, it is also responsible. So this plays a major role. And whenever a woman is infected with HPV, it doesn't mean completely that it's going to turn out to be a cancer, because our body has some immune response which fights with this virus and prevents it from getting into precancerous or cancerous lesions. So first of all, we need to get ourselves, like women should avoid getting infected with HPV. So who are the women who are at the risk of getting an HPV? So mainly having many sexual partners would be the primary cause, because they have more tendency to develop through the male partners. So that has to be avoided. And the other thing is having a early sexual activity. That also has a very risk of developing human papilloma virus in the woman. And the third one would be a weak immune system. Like a woman whoever has a weak immune system will naturally develop any kind of infections, and this HPV is going to be the most one. And the other fourth one would be the STDs infections, like that is sexually transmitted infections, which are like chlamydia, gonorrhea, and other infections. So these are mostly likely to have cause even HPV infections also. And one more thing is smoking. Smoking has a tendency to have a squamous cell carcinoma, because in the cervix, what happens is there are two types of cells, ectocervix and endocervix, where the endocervix has the squamous cells. So these kind of cells are mostly likely to be developing into precancerous or cancerous when they have a smoking tendency. And a mother who has been taking a medicine like diethyl stilbestrol in her younger age, or in the pregnancy or after pregnancy, so that medicine is likely also to develop into precancerous lesions in her late 50s. So these would be the most commonest causes for a woman to develop a cervical cancer. And apart from this, the other two important factors are the lifestyle modifications. Like women generally neglect their health issues, as Dr. Shibangi said, because they never even hesitate to tell what they have the problem. So first that has to be reduced. They have to speak up about their own health issues, because when the woman is strong, then the family is strong, then the society is strong, and then the nation is also strong. So that health status will be carried from a home to the nation. And other things are like even the menstrual cycle, or Dr. Divya has rightly said. So during the menstrual cycle, those small precautions have to be taken, like the healthy hygiene maintenance, or proper usage of the pads, or when they have to inform the doctor regarding those symptoms, all have to be alerted. So when they can be explainable to the doctor their own complaints, then we can even reduce the incidence of this cervical cancer.
Okay, now we understand that any reason that may lead to formation of abnormal cells in the cervix
Hmm.
may proceed towards formation of cervical cancer. So we have to take all the measures that abnormal cell production can be helped out. So Dr. Devya, can you help us understand what are the measures that should be taken to prevent this disease?
The first step towards prevention is regular screening, which will help us in early detection of precancerous cell in the cervix, which will enable us to go for early treatment. Apart from this, there are vaccinations for HPV infection, which is one of the leading cause for cervical cancer. And then one has to avoid having multiple sexual partners. One has to take protective measures during intercourse. One should not go for sex before the age of 16 years. One has to avoid smoking and has to maintain a good body weight. So, by following all these measures, we can reduce the risk of getting affected by cervical cancer.
Okay, thank you, Dr. Divya. Dr. Sirisha, can you help us with the methods that help us to screen the disease in early stage? The
Yeah.
methods of screening.
Yes, yes. Actually, the main goal of the screening is to detect the early cancer. So, if we can detect the cancer at the early stage, it can be treatable and it can be curable. So, what we do in the screening also, we identify two types, like we do a pap smear and we do a HPV test. So, both of these identify the precancerous cells or any abnormal cells that are turned out to be cancer. Okay, and there are a few recommendations from the American Cancer Society, which have been recently updated, that a screening has to be done at the older age, and at the first HPV screening has to be done. This was being a mandatory recent changes. So the age criteria has also been addressed here. So women who are less than 21 years need not go for any test unless they have any complaints as such. And a woman between 21 to 29 should undergo a pap smear. That is a small test which will be done by the doctor or the gynecologist at their own place, using a small brush which will take up the cells in the cervix. And this examination will reveal the kind of precancerous lesions or even HPV also. So from 21 to 29 years, every woman should undergo at least 3 times a pap smear. And from the age of 30 to 65 years, a woman should undergo pap smear 5 years continuously. And if it is coming to be normal, that is there is no any abnormal cells as such, she can discontinue the examination process. Or if at all she has any small confusion or small like thing, if it is susceptible or which is coming to be cancer, then they have to even go for HPV test, and both tests have to be done together for 5 years. And above 65 years, continuously for 10 years, the screening has to be done. and if the woman is not having any kind of abnormal cells for the continuously 10 years, then no screening is advised unless she complains anything. If it is any abnormal signs and symptoms are there, then she should be again screened for the next. Otherwise, screening can be stopped at that place. And there are other people who have to undergo the screening is a woman who is being tested for HIV positive and who is under immunosuppressant. That means a woman who has been donated or one of the organ or who has received. So those people are more susceptible to carry these HPV infections. So these have to be screened. And another one is the high corticosteroid usage. Those people also have to be screened for HPV and pap smear, both of them. And another important thing is a woman who has a long time of endocervicitis, which is not being treated with even local management or medicines. So long time treatment. So that woman should be definitely watched for longer period with HPV pap smear. And if at all any positive signs are seen, then she should be even advised to go for a biopsy test or a colposcopy, we say, a method where the cervical cells are seen very closely. So these are the step by step. And if any woman has a consecutive negative test for 3 to 5 years, then she can be given a gap at least for 5 years to undergo any kind of examinations. But any problem or any abnormal bleeding as such, then she has to get an examination done compulsorily.
Okay. So now we know how we can manage our lives and when we need a proper screening, what are these symptoms, or we have to understand where to dig in more. As you explained in a very proper manner that what is the age and what are the symptoms, what are the risk factors here, if someone is under immunosuppressant drugs or has HIV infection, so that person has to be careful and be under this screening. Thank you, Dr. Sirisha. Now I'll come back to Dr. Divya. Dr. Divya, would you like to burst some myths related to this disease?
Yes, there are many myths about all types of cancer in the society, and today I would like to mention the top three myths and facts about cervical cancer. Myth number one: cervical cancer affects only elderly women. No, this is not true. The fact is, girls as young as 15 years can also be affected by cervical cancer. Myth number two: if you are tested positive for HPV infection, you are sure to get cervical cancer in the future. No, the fact is, not all HPV infections lead to cervical cancer. Only those HPV infection which has remained for a prolonged time period might lead to cervical cancer, not otherwise. And myth number three: cervical cancer is contagious. No, the fact is HPV infection is contagious through sexual contact, but not the cancer cells. Cancer cells do not spread from one person to other. But infection can spread, which is the causative factor for cervical cancer.
Okay, thank you, Dr. Divya. Now, Dr. Sirisha, what are the very common questions or the questions that are frequently asked to you when a person or a patient is undergoing the treatment for the disease?
Yeah, actually, there are many fears for the woman to undergo a small treatment process also. Will they back to be normal as before, and would they be mentally stable, or would they be able to take all the responsibilities of the family? So, all these are the commonest questions, and most people will ask me. So, I would say that woman who has been diagnosed with the cancer and going with the treatment would not be as same as before. So her body will be changing. So body pattern will be changing. Her appetite will be changing. Her sleep pattern will be changing, and she may not be as stable as such. So, but all the measures have to be taken by herself and family to cope her physically, mentally, and even sexually also. So we would like to say, like, physically means she has some problems with her vomiting sensation or nauseating, and do not feel like eating, appetite loss. All these would be some feelings for her. So those have to be treated or addressed as per their doctor advice. And mental status also will not be the same. They have so much of fear, like, how do people receive me after the treatment, and would I be the same kind of work, like, if it is a working woman, would I be the working with the same status of my this thing or what. And so they have to be mentally made very strong, stating that the treatment is being under process and you will be the same, but you need to adjust with the situation. That has to be given for the patient. And in the because of the treatment process, like chemotherapies and radiotherapy, and even after the surgeries, what happens is the vagina becomes very much dry, and there will be a very narrowness of the vagina also, and they will not have any kind of that sexual drive also will not be there. So that partners or the women have to be understand their own status and explain to the family also, and they have to be motivated for the same. And after getting a counsel from the doctor, they can go ahead with their routine pattern also.
Okay. Thank you so much, Dr. Sirisha. I would like to thank both of you because it is one of the major discussions we needed, because women health is very important, and we know that women are a bit reluctant discussing their health problems. So I think and I hope this session has been very helpful for our viewers. And for any queries, for any confusion, the doctor is approachable. Please consult your doctor whenever you have any alarming signs in your body. I would like to wind up today's session. Thank you, Dr. Sirisha. Thank you, Dr. Divya, for joining us and giving or sparing your precious time to us.
Yeah, thank you, Dr. Shibangi,
Thank you
for
very
making
much.
us this opportunity.
Thank you, ma'am.
Thank you so much.
Yeah.
Thank you.